Hello, my darling, and welcome to the vet. So today we're going to be giving you a checkup, is that correct? Excellent, okay. So, just get some notes. So, can you tell me the name of your pet, please? Excellent. And what's the reason for your visit today? Okay, so you're getting some jabs and just a check over in general. Okay, well, that's good. Now, does your pet have any history of illness? Has been on any medication that we know of? No? Okay, wonderful. Now, can you recall from your last visit what weight your pet was? Okay. We'll weigh them again and see if that's changed or not. Okay. Well, I don't think I have much more questions. Do you know what the last flea wormer was? Okay. So your pet will be due very shortly. Okay. Well, in that case, I believe we can begin. So, I'm just going to start with a simple check on your pet's heart. Okay. So, I've got my stethoscope here. Maybe pop on some gloves before we begin. Right. Let's grab a pair of gloves out of the box. And let's just put these on. Excellent. Gloves are so sticky. Right, so again, like I said, let's just start with the heart check. Okay. So if you could hold your pet still for me, please, on the table, that would be wonderful. Or as still as you can. The vet's is a scary place to the animals. Right. Anyway. Now, my darling, this is going to be a bit cold, okay? A bit cold on your fur. Now, just listening to your heart. Okay, see. Do the other side too. Okay. Well, that sounds as good as I've heard a pet's heart in a long time. Anyway, so I'm going to grab my little torch here, and if you want to turn your pet to just face me, please, I'm going to have a look in their mouth, if that's okay. So I'm going to pop that down there for now. Right, so my darling, who wants a treat? Yeah, okay, you do. Well, I'm going to look in your mouth and then we can get you a treat, okay? Right. So I'm just having a look at all their teeth. Sharp little cat teeth, yes. They're looking well What age did you say your pet was again? 15. Okay, yes. Just as I thought. Teeth have seen some wear and tear over the years. Yes. Okay. I'm going to grab just gentle little scrapey tool, and I'm just going to remove any tartar buildup. Okay. Just gently scraping your pet's teeth. Now, just gently scraping. It's not sore on your pet whatsoever, just gentle. So, do you ever brush your cat's teeth or... No, okay, you find it quite difficult. Yeah, I totally get that. Yeah, I find a lot of pet owners just can't do it as they struggle because the cat will claw them or the dog will growl. Yes. But there is means and ways of getting around it, you know. Anyway, we'll just continue scraping away that build up on the teeth. Just gently scraping. Okay, now I did notice, unfortunately, we do have a rotten teeth, so I think we may have to extract that, unfortunately. Now I can go ahead and do that now, but I will apply the numbing agent and then we'll go ahead and do the jabs whilst that works, if that's okay with you. Excellent. I'll just get you to sign this little consent form here. Right, so I'll just put my signature here. Now, if I can just get you to sign there. Excellent, thank you very much. So, I've got your consent to go ahead with the anaesthetic and teeth removal. Okay, perfect. So, just going to... let me just have a quick look where I should be applying this again. Okay, yes, it is done. Right, I'll just pop this anaesthetic into the gum very slowly, very gently. Just putting the anaesthetic in very slowly. Okay, very good. Right, almost there. I can't put it all at once. Now I'm going to get some more. Just do it again. Just two sides of the gum, just so we know that you can't feel it, okay? Yes, there we go. Just almost there. Last little bit now. Excellent, okay. So we'll let that sit for a moment, and in the meantime, I'm going to apply the next vaccines and jabs. Okay. So. Alright. So you want to turn your cat to just face that way, if that's okay. Perfect. And just in the front leg, I'm just going to apply the vaccine. Just. Oh, sorry. I'm so sorry, darling. It's so sore. I know. It'll be over soon. And that's us done. Excellent. Good job. You did a good treat. Here you go. Have a treat. Yes. Good cat. Oh, I know it's very hard getting all this done, but unfortunately it all needs done. So, I'll just make sure your charts are up to date and all your papers. Now the anaesthetic needs a moment more to work. So in the meantime, I'm going to check your cat's ears, up their nose, and just have a look around the eyes for any gunk, and check the fur, okay? Because it's tick season. Right, so just going to check in your ears. Just looking in your ears. Lovely, okay. Very clean, they are indeed very clean. And again, just looking in the other ear. Excellent. So, it's safe to say ears are immaculate. Do you clean them? Do you use any drops or anything as such? No, okay. Well, your cat certainly does a good job of keeping them clean, I'll tell you that now. So you needn't worry about any infections as such. Now we'll have a look at that little pink nose. Nothing out of the ordinary that I can see, which is great. And in those little eyes too. Excellent. Okay. No gunk, no build up, no nothing. It's a perfectly healthy 15-year-old cat. Wonderful. Okay. Now, just turn him to the side again. I'm just going to check his fur. Yes, just checking. And I'll get my torch out so we can just check if there's any ticks or anything that we don't want there. No. Okay. And if you turn him to face you, okay. And turn him to face that way. And now just lift your paw up. Oh, it's okay. Don't scratch now. And we'll just lift the other paws up. And if you turn him to look that way, please. And we'll do the front paw. And the back one. And under the belly. Okay. Well, I have to say, your cat's skin and fur is all looking well groomed and taken care of. No areas of concern there. then in that case, we have a tooth to extract. Now this is going to be slightly traumatizing, but cat shouldn't feel any pain whatsoever. So got a little pokey tool again, and I'm just going to jab the gum and see if he feels it or not. No, okay, a little bit harder, just. No, okay, completely oblivious, that's what we like. Then in that case, we've got a tooth to come out. So, let's get my cotton pads at the ready. And let's just aim and pull. Okay, put that to the side there. And as I suspected, a bit of blood, so I'll go in with the cotton pad, just holding that a moment. I'm going to pack it in the comb. Now just pop that in for a moment. Okay. Now let's just remove that. See if we got all the tooths. Yes, I believe we did. Okay. Well, you've been a good cat, so I believe you can have a treat. Here you go. Yeah, good cat. Okay. So I'll pop that in the record. I need a tooth extracted. And what's the date today? The 9th of June. Excellent. Okay. So that is all I believe we have to do today. Your cat has been wonderful. Now, I believe the only thing left to do is, if you want to pop to the secretary just through by, they will take your payment for today. And they can book you in for your next jabs and stuff, which won't be for a while yet, but it's always good to plan ahead, if you know what I mean. And you can browse our selection of treats and cat toys and stuff, and if you think your cat needs different food, then there's ones there, but teeth, ears and everything are amazing, so I think what you've got at the moment is absolutely top notch, so I see no need to change to a different food or anything at the moment, as they appear to be perfectly healthy, bar that one tooth. I don't know what happened there, but, and like I said, you can try the teeth brushing. We have specific pet teeth brushes in our shop, and teeth paste. As I said, it can be quite a task, but it's worth it in the long run. And as your cat's quite an older cat, then they'll be more inclined to settle down and, get their teeth brushed. As younger cats can be quite vicious, if you know what I mean. So, on that note, I'm going to love you and leave you, as I do have another patient coming in very soon. So I must get cleaned up and prepared. But it's been lovely seeing you, and I hope we see you again soon,